Donnelly, our wonderful social worker, and she's going to be talking to us about support that's available for patients and families.
Good evening, everybody. It's really a pleasure and a privilege to be here with all of you tonight. My name's Laura Donnelly, and I'm the social worker in the Melanoma Clinic, and work with these wonderful physicians and staff that we heard about this evening. And I'm here to talk tonight about support for patients and families. As a social worker in the Melanoma Clinic, I can be a support and resource for all of our patients and families. Really at any point along the continuum of care, from diagnosis through treatment and into survivorship. So I'll start with the time of diagnosis. Hearing the words that you have melanoma or you have cancer can be a very life-changing and overwhelming statement for many people. And so I'm available really from the very beginning, from the very first visit with the medical oncologist, and sometimes even before that. Just to give a little bit of history, the NCCN, which is the National Comprehensive Cancer Network, is an organization that provides guidelines for major cancer centers, such as Smilo, but also throughout the country. And several years ago, in talking with patients, they learned that patients were very pleased with the medical care that they got. They found that their doctors did an excellent job of treating their disease, but many patients felt that along the way, they could have benefited from some emotional support. And so that started to become a priority for many cancer centers, also at Smilo, that social work and other services are available to emotionally support patients through the experience. So some of the initial feelings people feel at the time of diagnosis, feelings of shock, fear, and anxiety. Perhaps there's concerns about how to share the news, who to share the news with. Maybe there's coworkers, friends, family, neighbors. There can be often a sense of a loss of control that this illness can bring, and managing those feelings, as well as feelings of loss in general. So those are some of the initial conversations I have with patients. Getting back to the NCCN, one of the things that they developed was a tool, like a survey, that medical professionals could administer to patients when they're newly diagnosed to really understand an individual person's level of distress. And so our nurse coordinator, Kathleen, when she's talking with patients when they're about to come into our office, asks a series of questions to really identify what stressors a person maybe already has, and that helps me to identify who needs support maybe more quickly, and I can, follow up by a phone call or sit down with that person at the first visit. So those are, some of the things I do, and I really want to stress that it's not just patients, but also family members that are greatly impacted by this, and our services are for family members as much as patients. So assistance with processing feelings, problem solving, coping, navigating the resources that are within the Smilo system and the Yale New Haven Hospital system, as well as within an individual's community. And then moving into treatment, I have an image of a roller coaster because it can be a very up and down roller coaster-y kind of ride. Oftentimes, some of the distress has eased a little bit once a plan is in place and some of the uncertainty has been mitigated. People start to feel a little bit better. But it still can be a very stressful time. If any of you have been to the 8th floor infusion center, we have very small cubicle-like settings, and I'm always happy to go and sit and talk with patients as they're starting treatment. Sometimes new issues come up, new challenges come up, and so it can become a process of navigating those ups and downs. Also, one thing that I've experienced working with patients throughout this continuum, throughout this process, is that a lot of times at a certain point, people really want to seek some meaning in this experience. And perhaps with the diagnosis, sometimes it means a pause in a work schedule or a change in normal activities, and people feel a little bit lost sometimes. And how do I, now that I'm going through treatment and I'm just coming back and forth to appointments, how can my life still be meaningful? What do I really want out of my life? So those are some of the conversations I have sort of maybe in the middle of treatment. And then I wanted to talk for a moment about our support groups. We have several support groups that our melanoma patients can participate in. We have a melanoma support group that meets the third Tuesday of every month here at Smilo. It is also for family members if they'd like to join. And I put some flyers outside on your way out. And also, if anybody is interested, you can leave your name and number or email address if you have any questions. It is really a wonderful group. It's a great exchange of information, of resources. We discuss challenges, but I think a lot of people come away with a real sense of hope and are very uplifted. Additionally, there is a caregiver support group that is just for caregivers and family members, and that meets twice a month. I've also left flyers out on the table. And our meaning-centered psychotherapy group is a short 6-week program that runs at various times throughout the year. It is intended for people with advanced cancer, so stage 3 and stage 4, and the focus really is on finding meaning in this experience. And I also want to mention, I neglected to put it in my PowerPoint here, but there is a young adult support group for people who are in the ages of 18 to 40. That age group has, is at a unique point in life, and people at that age find it beneficial to get together. So it's a multitude of cancers, not just melanoma, but melanoma people in that age range are certainly welcome to attend that group. And then finally, into survivorship. Survivorship is a little bit, actually the term survivorship, a person is a cancer survivor from the day they're diagnosed. So really survivorship begins then. But for the purposes of this, it's really post-treatment that I'm talking about, and that's support after treatment. And as we heard today, these new drugs, there are more and more people living longer and longer with as melanoma survivors. They're living 10 and 20 years, much longer than in the past. So we have more melanoma survivors in the post-treatment world than really ever before. So we want to continue that support. Many people look forward to finishing treatment. They can't wait till they don't have so many appointments at Smilo, and then find that it maybe is a little more of a difficult transition than anticipated. There can be a lot of fear with not seeing your provider quite as often, trying to return to a new normal. Perhaps friends and family think, this is over, this was in the past, you're great now, but you don't quite feel the same. Maybe you want to redefine your life a little bit and reprioritize things, and that takes a change and a transition as well. And then here at Yale, we also have a survivorship clinic, which is an opportunity for people post-treatment to really formalize a plan for sort of this next chapter. And then to sort of segue to the next speaker, who's Dr. Dwayne Fahan, he's going to be talking about resilience. I was looking for an inspirational quote or something that really, I think, resonated with my experience of working with patients here. And your life is your story, write well and edit often. I think that every patient who walks through our doors at Smilo has a story, has a life full of experiences, of joys, of challenges, of coping skills and resilience they've developed along the way. And I think when you reach a diagnosis like this is really just another chapter in that story, and it really can be a good chapter, filled with many good things. And I think it requires to edit often. Sometimes things don't always go the way we plan, but it can be a great story. And that's it.